Hello, this is Cameron with Cutting to the Case, Conversations in Orthopedics, and this is Dr. Joseph Abboud. And Dr. Abboud is actually the a professor of shoulder and elbow surgery at the Sidney Kimmel Medical College of Thomas Jefferson University, and the chief medical officer of Rothman Orthopaedics, and chairperson of the ASCS Foundation for Shoulder and Elbow Surgery. So, welcome to the podcast, Dr. Abboud.
Thanks, Cameron, for having me. Appreciate you guys inviting me on. Really excited.
Absolutely. Yeah, thank you so much. And, to really kick off the conversation here, um, you know, about shoulder surgery, you're obviously an expert in the field. What do you believe most shoulder surgeons get wrong about tendon biology or healing timelines? Very curious.
I think that because orthopedics is such a concrete, see it in front of you, surgical intervention, that a lot of times we are aware of it, but we forget that there's a whole cascade of biology that happens after we've closed the wound or put in the implant. So that biology is still the key aspect of figuring out the holy grail of why tissues heal or don't heal, why we have successful outcomes, specifically things like rotator cuff tendons, which are particularly perplexing as far as challenges with healing and their failure rate as we get older. So I think the biology is still something that we often struggle with. We've struggled with it throughout my entire career. I think we've gotten better at it, but we haven't figured it out fully.
Yeah, I appreciate that, and we'll switch off between me and Bob here.
Great. Excellent. So, our next question is specifically about your work over at Rothman. You have had a significant role over Rothman's overall academic as well as its clinical arc. How would you, as such, define institutional excellence in the space of orthopedics?
Well, I think, at Rothman, it starts with our founder, Dick Rothman. He really stressed the importance of being an excellent surgeon, being an excellent educator, and being an excellent researcher. And, that trifecta, that triple threat was kind of the foundation of how Rothman was started originally by a few members and then has grown to be an extremely large private practice group. And for many years, we have, as an institution, we have been the most prolific or productive orthopedic department slash program in the country as far as number of peer-reviewed publications put out per year by the Department of Orthopedics. So we pride ourselves on excellent patient care, really focusing on what questions need to be answered, how to mentor students, how to create that same passion we have in our soul about this profession in the next generation. So I think it's a collective effort by everyone who works at the institute. I don't think and we try to get people with diverse backgrounds, but share a passion for all those things.
Yeah, that's absolutely fantastic. And you did mention a lot of research going on at Rothman as well. And that's particularly interesting to me. I'm interested in orthopedic research as well. In your view, what's the next real inflection point in shoulder surgery? Is it biologics, augmented implants, or something else entirely?
Well, I think as we're seeing already, um, I think the influence of AI in our field is going to be tremendous. I don't think we fully comprehend what it's particularly going to do, but I think it's going to allow us to understand big data a lot quicker and faster. I think that you know how it affects our decision processes in surgery or analyzes our position placement of certain things like let's say a glenoid implant, et cetera, is going to be interesting as far as how things evolve. But I think artificial intelligence will be the big factor. I think second will be probably more emphasis on biologics and potentially robotics.
And just kind of specifically expanding on that note, Are there any examples of AI that you have seen as of yet being used in the space? And also, how do you think AI may actually expand access to orthopedic surgical care?
So yes, we do see it in the space for your first question. And, we see it now being used by uh, companies that provide the ability to watch you in a room, interact with a patient, and based on cues, understand sort of what you're discussing with the patient, and then also what you're examining in your exam findings, and generate a note based on, machine learning algorithms after it's seen you a few times. That's just one example. We've seen AI have potentially sometimes a negative impact by people potentially using it to write papers or abstracts that are not necessarily their own or unique. So there's a fine line between using things that help you versus things that I would say are not straightforward or ethical shortcuts. But those are just simple ones. I'm sure people are using it to understand how a patient will do with a certain procedure based on crunching the big data and seeing, okay, this patient with these comorbidities, this, let's say, bone quality, this implant is going to have this risk factor for, let's say, a periprosthetic fracture, or um, uh, their outcomes may not be as good secondary to that. Your second question was, how is AI? What was that? What was the second
Yeah,
part?
so uh, are there any ways in which you actually foresee AI being used to also expand access to
Yes.
orthopedic surgical care?
Yeah, just like the internet, before you guys were born, changed things. The AI is going to allow people to do things on the internet that are much faster and to be much more zoned in on what they need. So obviously, people need to have access to a computer and internet or smartphone, et cetera, I guess these days. But they then will be able to, I think, fine tune exactly what they want, and the search will be so refined and quick. Versus, I'm sure you all do a search on a search engine and wade through pages and pages of stuff to figure out what you exactly wanted, versus a smart AI algorithm can do that in seconds versus hours. And I think that'll help patients because they may be looking for somebody who specializes in a rare disorder that's in a certain vicinity, etc. So with a certain amount of experience. So those things are hard for people to navigate, and a lot of times now it's just word of mouth. Oh, do you know a good hematologist? Do you know a good cardiovascular specialist, etc. And somebody that specializes in this abnormality specifically, and you're getting word of mouth, which is very can be helpful, but can be also very laborious.
Yeah, and I have a two-part follow-up question to that as well. So the first part is, with the introduction of these artificial intelligence models, are you concerned that the next generation of surgeons might lose touch with maybe the physical exam, the diagnostic intuition, perhaps even suturing or anything else that maybe robots can help with in the future? And then I have a second question, but I don't want to overburden you here.
Yeah, no, I do worry about that because you know don't forget what you do is patient care, right? And there's no algorithm or artificial intelligence to transmit care. Empathy, kindness, listening, those are all things that we do as providers, physicians, healthcare professionals. That's very special. And it's a sort of sacred experience that we have with the patient in the room, discussing their problem in an open fashion, going through our own algorithms in our mind to try to figure out what's going on. Examination is still an extremely important part of what we do on a daily basis, regardless of specialty. And forgetting those nuances and relying just on navigation, AI, etc., could be problematic. I mean, I think that you see that as a small example with driving, right? I mean, I think that 25 years ago, when we didn't have navigation in the cars, you either remembered how to get somewhere, learned the road, looked at the maps, read a map, understood things. Now people just look at a screen and follow the blue lines, and sometimes it takes you bad directions or wrong directions or not smart directions, or maybe not the direction you want to go, right? So I think there's a lack of, I mean, maybe it'll get better, but those are things that you have to be concerned about, that you just sit in the chair and let it do whatever it wants to do. And you lose that special touch between a patient and a provider. That's really important, key to the care of the person. Because, you know, I don't know what the future holds, but I don't think it's going to be able to replace the power of human connection, kindness, empathy, those types of things that are transmitted between us in person, which is even harder to transmit to each other on a Zoom call, right? So, you know, meeting you is very different than talking to you on a Zoom call. And that's kind of, you know, the thing about AI. It's very, I would say, at least at this point in my mind, impersonal.
Absolutely understand. And yeah, Bob, if you want to ask the final question as well, we want to keep this short and concise for out of respect for your time. We said it would be 15 minutes.
Yes, certainly. So as kind of our last question, it's very evident that you have, accomplished so much as a surgeon, as a leader. What at this point do you feel is next, specifically for you? Or in other words, what is as of now left unfinished that you hope to see out over the next few years ahead here?
Well, I think I'm very passionate about mentoring young minds and young individuals, and sort of having them sort of learn from sort of some of the trials and tribulations I've gone through, to not necessarily be able to fully avoid them, but to kind of understand where some of the issues are, what are the things that you need to do to get to where you need to get, and not necessarily make the same mistakes. I love working with young people, and the energy and the excitement they have on their face when they've discovered something or done something for the first time, or caught that bug, right? That research bug or that publication bug the first time they see their name on a paper, and they've just got that research bug for the rest of their life. So I really love mentorship. And I think that when you're young, the analogy that people often use is you're a player in the game. And when you're older, you're a manager in the game. And so, well, obviously I'm a surgeon and I practice surgery. Now, not only do I practice surgery, I help young surgeons or young players learn how to play more efficiently, play better, play smarter, so they can excel in their career. And that's something I'm really passionate about. And you know, there's a lot of innovation still to be done. And the area of shoulder surgery has been highly innovative in the last 20 years. I was lucky enough to get into it, and it's been the most innovative subspecialty in orthopedics in the last 20 years, as far as devices that have come out, publications that have come out around the shoulder. So it's really an exciting time to be a orthopedic surgeon, and particularly a shoulder surgeon.
Yeah, and we really appreciate your insights. So we promise to keep this within the dedicated time frame. So we really appreciate your insights, and we appreciate your commitment to mentorship as well. Even in these positions of power, as you elevate, that's the sign of, an incredible surgeon, is you're able to uplift others as well. So we appreciate you having your time open. Bob, if you have any final words as well.
Yeah, no, I just, wanted to echo all of that I think it's just extremely inspiring for us as future surgeons and healthcare leaders to get to speak with, various giants across the field, and it's always just extremely appreciated.
It's very humbling that you say that. Thank you so much for your kindness, and
Absolutely.
pay it forward when you advance in your careers.
Absolutely.
Absolutely. So thank you very much. This has been Cutting to the Case, Conversations in Ortho, and see you next time.